Hello, guys. Welcome to Medicate. Today, we're going to look at histamine. And what we're going to study here basically is pharmacological overview of histamine. Pharmacological overview means that you state the example, which is histamine itself, as we've seen here in this slide, with the structure of histamine and the chemical name, which is B-aminoethyl. As well, we will look at indications. This is where histamine is applied clinically. Also, we will look at actions, the mechanism of action of histamine in our bodies, as well as the adverse reactions, not forgetting the contraindications. Contraindications are situations whereby a drug should be used with a lot of care or should never be applied. But before we dive into the pharmacological overview, of course, it's equally important to understand the biosynthesis and metabolism of histamine. Histamine is being made from a protein called histidine in our bodies. And the process of making histamine in our bodies is through decarboxylation. Histidine is converted into histamine by L-histidine decarboxylase enzyme. The breakdown happens in two stages. On the right side, I have a pathway that converts histamine into imidazole acetic acid by DAO, which is diamine oxidase. And the next process is the conversion of imidazole acetic acid into imidazole acetic acid riboside by the use of 5 phosphoribosylate synthetase and also 5 uh, nucleotidase enzyme. Here, ribose is used in the process. On the right side, we have done. On the left side of the pathway, we will look at another process by which histamine is converted up to N-methyl-imidazole acetic acid. So histamine is first of all converted into N-methylhistamine by histamine N-methyltransferase enzyme. And then the intermediate N-methylhistamine is converted by monoamine oxidase B enzyme into N-methyl imidazole acetic acid. So this is the brief overview on how histamine is being produced and how it's being broken down in our bodies. As well, we would need to understand these few important points about histamine. Here, I'll basically tackle site of production or where it's being stored, uh, the sources or the cells that produce, and also the main role. In the immune system, such as skin, lungs, and the gastrointestinal tract, and also the mucosa. So, histamine is being produced in the mast cells, the granulated cells, and also by the basophils. And their main role there is that they mediate allergic reactions and also inflammations, especially the ones that are being induced by allergens. Secondly, we will look at the CNS, the central nervous system. Histamine here is produced majorly by posterior hypothalamus. And the cells that are responsible for production are the histaminergic neurons, which are found inside the tuberomammillary nucleus, inside the CNS. And what role does histamine play here is the circadian rhythm, the regulation of sleep wake cycle, and also the arousal as well as cognitive responses. In the stomach, especially at the gastric mucosa level, histamine is being produced by ECL cells, the enterochromaffin cells. And what role does it play here is that it stimulates the parietal cells to secrete gastric acid. well as microorganisms in the gut. So there are bacteria that uh, that uh, combine with histidine or react with histidine decarboxylase and also produce the histamine. And here, the role that it plays is that it takes part in the production and also the influence of the gut physiology inside the gut. So basically, here, some microorganisms in the gut can also avail or they can produce histamine, which can be used in the gut in processes such as the gastric acid secretion. We will look at the histamine receptors, very important. We have major four categories of histamine receptors: H1, H2, H3, and H4. Histamine receptor 1, basically, it's found in smooth muscles, endothelium, and brain. Histamine receptor 2 is found in the gastric mucosa, the heart cells, and also the uterus. For histamine receptor 3 is found in the central nervous system, and they act as the presynaptic autoreceptors. Histamine receptor 4 is found in bone marrow and the leukocytes. Uh, Next, we will look at the agonists. Agonists are the substances or chemicals that promote the actions or the work of histamine receptors. Number one, we have beta histine. Beta histine is an agonist of H1, the histamine receptor 1, but it's also a weak antagonist for H3. Secondly, we have 2-methylhistamine, which is an agonist for histamine 1 receptor. Another chemical is the dimaprite. Dimaprite is an agonist for histamine 2 receptors. And we have the R alpha methylhistamine, which is an agonist for H3 receptors. Lastly, we have 4-methylhistamine, which is an agonist for H4. And we will again look at the indications of those agonists. The agonists' indications or applications in a clinical aspect is that they're used for testing or diagnostic purposes, such as testing gastric secretion. And another one is vestibular disorder, like uh, the beta histine as well. Also, in the research, they are being applied to discover more drugs. And what are the actions? The actions of the histamine receptors. For histamine receptor 1, it takes part in vasodilation, bronchoconstriction, and also the vascular permeability that it increases. For the H2 receptors, they take part in gastric acid secretion. They also increase the heart rate and also participate in vasodilation. For H3, the, the decrease they decrease histamine release, and they are also known as the autoreceptors. So for H4, uh, take part in chemotaxis of immune cells. This is the mechanism by which histamine works. So for each category or for each receptor here, this is the way histamine works if it's taken into our bodies. Basically, the mechanism of actions of the agonists of the histamine is what is discussed in this slide. So next we are going to look at antagonists. So antagonists for H1 receptors, we have the uh, diphenhydramine, we have the loratadine, we have the cetirizine, and we have also the chlorpheniramine. So for H2, we have ranitidine, we have the famotidine, we have the nizatidine, and also cimetidine. So those are the antagonists for H1 and H2. For H3 antagonists, we have the phytolacin. Then for H4 antagonists, We have the J&J drug, which is currently under research reviews for indications of the antagonists of the histamine receptors. This is where they are being applied. For H1 antagonists, they are used in allergic reactions such as rhinitis, urticaria, and they're also used like anaphylaxis when applied together with adrenaline. So, in motion sickness and insomnia, they're also used there. For H2, it's used in uh, peptic ulcer disease as well as the gastroesophageal reflux disease and also the Zollinger-Ellison syndrome. For H3, uh, antagonists. They are used to treat narcolepsy, cognitive disorders, and for H4, uh, they are used to treat inflammatory diseases. Next, we will look at the actions. After we've looked at the indications where these are being used, we are going to look at the actions of histamine antagonists. So for H1 blockers, they are used to prevent histamine-induced bronchoconstriction, vasodilation, and capillary permeability. So H2 blockers are used to reduce gastric acid secretion. H3 blockers are used to enhance histamine release and improve wakefulness. For H4 blockers, they are used to reduce immune cell chemotaxis. The contraindications, this is where they shouldn't be used. So, if a person is hypersensitive to the drug, it should be avoided. Also, H1 blockers should be avoided in glaucoma and also prostatic hypertrophy, especially the first generation blockers. So for H2 blockers, take a caution in a patient with renal or hepatic impairment. For H3 and 4 blockers, still it's under research and more studies are being done to give more recommendations. Uh, Adverse reactions that are being induced by these histamine blockers. For H1 blockers, they induce sedation, especially the first generation blockers. So they also cause dry mouth, urination retention or urinary retention, blood vision, and in the CNS, they cause dizziness and fatigue. And also, in terms of allergic reactions, they are not common, but some people will experience allergic reactions. So, for adverse reactions of H2, we have headaches, can be experienced, dizziness, diarrhea, constipation. For cimetidine, can cause gynecomastia. And in the elderly or when you take overdose, confusion is likely to occur as an adverse reaction for H2 blockers. So, what about the H3 and H4 blockers? What are their adverse reactions? So, for H3, commonly patients get to experience insomnia, headache, and nausea. For H4, it has limited data and it's being studied and more knowledge is upcoming, and mostly at the moment it's being used at an experimental level. Well, to summarize, we've understood that histamine plays good roles in allergy, gastric secretion, neurotransmission, and also immune modulation. So agonists mainly are used in research in diagnosis. Antagonists are widely used therapeutically as blockers, and histamine can also be used in monitoring drug interaction, just like cimetidine, which is the cytochrome uh, P450 inhibitor. Thank you so much. Thank you for making it to the end of this video. I really appreciate your time. If this video was helpful, item to you, please subscribe, comment, and share it with the relevant viewers. Until next time, I will come back with serotonin.